Hey guys, can you guys hear me okay? Howdy, howdy. Wonderful. Hey Denise, hey Keith. Hey Even So as well. This is fantastic. Hey Pink Meadows. Good morning everybody. Aaron Boster here. I have revamped my live stream. I am really excited to jump online. I was hopeful that you'd be here to support me. Byron, what's going on in South Africa? Sorchet, is great, of course, to see you. Rain for the first time since July 1st. This is fantastic. Hello, Elizabeth. Hello from India. This is fantastic. Jan is in the house. Wow, I am really excited. I'm gonna give an opportunity for some people to jump online. I've got a fresh cup of coffee brewing. I am really excited to share with you my whole new revamped live stream. I'm really hopeful that you're gonna dig it. And there will be no Snapchat filters today. Hello Marie in the UK. What's up Elaine in the UK? Travis is in the house. Oklahoma is in the house. This is phenomenal. We've got Norway in the house. There's 73 of you. Let's get to 100 and I will go live. Get your beverages ready. You know about the MS Water Challenge. I'll be back in 1 second as soon as I grab my coffee. Laura, thank you so much. Loving it. .78 of you online. As you jump online, make sure you tell me where you're jumping in from. We've got Scotland represented. We've got Texas up in the house. We've got Indiana. This is fantastic. Candy, you've got your mug. Oh my goodness gracious, that mug is at work. It's the most beautiful thing, made me tearful. Beaver Creek, what's up, is in the house. We've got Cornwall representing. That's amazing. Mississippi representing. Indiana's in the house. Fernando knows how we show flames up in here. Minnesota representing, we've got Delaware and Greece. This is phenomenal. Canada is in the house. Newfoundland, Chicago, PA is in the house. Look at this, Utah, Holland, I love it. Of course, Ireland is representing. This is another Texan, woohoo, Wisconsin. 81 people are there. I can't wait to do an Ask Me Anything MS with you guys today. I have spent the better part of the week during my free time completely revamping the chat here. I've revamped almost all of the scenes. I'm really excited to get some feedback from you guys. I hope that you think it's really fun. I am definitely very excited about it. Let's give a little bit longer for people to find their way in. This is of course impromptu, not one of my standard monthly live streams, although I absolutely love this Saturday time frame. If you guys prefer Saturdays, go ahead and give a comment. Let me know if that sounds good to you. One of our moderators, Even So as well, is reminding you to jump out of the chat, throw a thumbs up. That's how we show the YouTube algorithm that we love what's going on. Thank you for that comment. We've got 90 people here. Let's grab 10 more and we will go live right at 100. In the meantime, get your questions ready. Get your questions ready and keep in mind that I can't diagnose or treat you on the interwebs, that what we need to do, of course, is ask general questions so that everyone can benefit. If you guys like Saturday the best, as opposed to my standard Monday, Wednesday, or Thursday live streams, I am happy to accommodate. I can adjust so that we do our monthly live streams on a Saturday. Leave a comment. I go through and read these all at the very end. I'm getting a lot of thumbs up. Bluethen is in the house. What's up, my friend? Another amazing moderator who has been with this channel since the very beginning. Annapolis, Maryland is in the house. Oh, Rocker Chicken down in Mississippi thinks this is a good time. Sorch is going to have an MRI. We've got our fingers crossed for her. Let's throw her some love. This is fantastic. We've got 90 people online. I can't believe it. Bluethen, hold on to that question, partner. We're gonna get rocking and rolling here as soon as 10 more people jump on the chat. Christopher, thank you very much. I have to be honest with you, I gain a lot of energy and have a lot of fun on these live streams. Sarah Woods is in the house. What's up, lady? Nanny is in the house. Rockin' New Hampshire is representing. This is fantastic. Claudia down in Georgia is superb. Jane is right here. This is really, really great. As you jump online, make sure you tell me where you're jumping in line from. We've got only 2 more guests to jump on. We'll hit 100 and we will go live. I am so excited to share with you what I've got in store. I've got all new scenes. I've got some whistles and bells, and I've got absolutely no Snapchat filters today. So let's give it another couple seconds to grab some more people. If you guys want to throw a heart in the chat, I love the love. If you guys want to flame up the chat, we just hit it, guys. Let's go. Hey, howdy, hi everyone. Dr.Boster here. I am delighted to jump on a Saturday live stream. It looks like this might be the best time of the week to connect with y'all. I am really, really excited to be here. There's 101 of you that have saw fit to jump online with me already. Thank you very, very much. I am super excited to do an Ask Me Anything. I've got some new scenes planned. I promise no Snapchat filters today. And this is really exciting. It's something I've been hopeful would work out for the whole week. And so thank you for being here. We're gonna do some questions, and I'm gonna change up the scene with every question. Let's just do a quick check. Can you guys hear the music okay? So right now, let me know, is the music too loud? Is the music too soft? I've got different music for every scene, so I'm going to be asking you that question each time I flip the scene around. Let me know if the music is too loud or not loud enough. I'm going to make an adjustment here. Make sure you can see that question. How's the level of the music, guys? Music, okay. Too loud, soft. All right. Candy thinks the music's okay. Entropy thinks the music's okay. All right, okay, cool. So each time I switch up the scene, let me know if you think the music is a bit too loud or not. I've got all new music for you guys because I was worried that you might get a little bored. Oh, Suzanne throwing up some love. I love that. That's fantastic. All right, let's take a look at some questions here, guys. I'm going to look for the first question. Here's a question that we'll start with. This question is from Sarah, and Sarah writes, what are your thoughts on Briumvi? I found out that the infusion center that I'm only the second person in Providence, Portland to be on it. Flu-like symptoms and headaches suck. So Briumvi, which is a B-cell depleter, is the newest B-cell depleter to join the MS armamentarium. So the long name is ublituximab. So Briumvi is ublituximab. And Briumvi is in the same class of medicines as ocrelizumab, that's Ocrevus, and ufatumumab, which is Kesimpta, and rituximab, which is Rituxan. So we now have 4 medicines, 3 are FDA approved for the use in treating multiple sclerosis. Briumvi, ublituximab, is the most recent one. It's an IV given in the vein, and it's given every 6 months. Briumvi is formulated differently than the other medicines. It's glycosylated, and that allows them to use a lower overall dose, reportedly with the same binding and efficacy. The first infusion of Briumvi is given over 4 hours, and every subsequent infusion is given over only 1 hour. And so many folks are excited about the fact that this can be given faster. I have used it in clinical practice a handful of times. I was indirectly involved in some of the clinical trials. I backed up my friends that were doing the trial where I was working before. And I'm very excited that there's another high efficacy option to help people with their MS. So I think the exact way that Briumvi plays out in clinical practice is still early on, it's early days. We don't have a tremendous amount of clinical experience. It's been on the market for well less than a year. And I think that it's excellent to have options. So thank you for that question. I'm going to try to scroll back up so that I'm not missing a lot of questions, and I'm going to change up the scene. So this is a brand new scene. Let me know if the music is too loud or if the music's not loud enough. And as we go through the scenes, if you like one in particular, definitely let me know what you think about that scene. Please keep in mind, check this out. Wow, we're gonna do some falling questions just to change things up a little bit. Having a lot of fun today. Teresa said you could skip the music. I think it's nice to have a little background music. That's my own opinion. If you feel differently, definitely leave something in the comments and let me know what you think. And so here's a good question from Teresa. Do you recommend annual booster for MSers? So I think it depends on what you mean by booster, Teresa. So if you're talking about the COVID-19 booster, I do think that's a good idea. I do recommend that my patients get a COVID-19 booster because unlike other conditions, you don't typically maintain your immunity. I also think that it's a good idea for people impacted by MS to get a flu vaccine. And so there's an annual flu vaccine that I also think is really, really important. That's a great question. Thank you for asking it. Let's try to find another question. And by the way, if you haven't yet, give the chat a thumbs up.
Oh, yeah.
Sorry, I couldn't help myself. All right, let's look for another question. So here's a question from CJ. And CJ writes, hi, Dr. B. Well, hello, CJ. Been given Tegretol to assist with my MS symptoms. And it's specifically describing some numbness, tingling, change in sensation in the neck and the hands and whatnot. Any specific side effects to be wary of? My neuro mentioned low risk of skin rash. So Tegretol, which is carbamazepine, is an old school anti-seizure medicine. It's very effective for helping with neuropathic pain. I use it first line for Lermite's phenomenon and for MS hug. There's a couple things with Tegretol that we want to be aware of. Number one, it's metabolized by the liver. And so we need to check liver enzymes, and we need to make sure that we're not drinking lots and lots of alcohol or taking lots of other medicines that are metabolized by the liver. Number two, it can drop your sodium. And so you want to check a electrolyte level every once in a while and make sure that your sodium's not dropping. That's a rare side effect. Number three, very rarely you can drop your white blood cell count. So you got to keep track of your white blood cell count, which basically means we need to draw some labs every couple months while you're on Tegretol. And Tegretol can be a very effective medicine. I think rash with Tegretol is very, very uncommon. There are some newer medicines like oxcarbazepine, and so these are medicines that certainly can be used instead of Tegretol, although I do find that Tegretol can be very helpful. Tegretol is very, very inexpensive. As I mentioned, it was originally invented for seizures. This is a coffee talk, and I've got my coffee right here. So here's a really good question, and as I promised, we're going to change up the chat. This changes up the music as well. If you guys like this scene, definitely let me know.
Yeah.
If you don't like the scene, let me know. I'll be honest, I'm a neuroimmunologist, not a graphic design computer guy, so it was really hard for me to figure out how to do all this stuff, but I hope that you get a kick out of it. This question comes from Claudia. Would a stem cell replacement work for me as a cure? So stem cell transplantation is not a cure. I know for a fact that at least one of our participants right now has gone through a stem cell transplant up in Ireland. She's talked about it quite a bit, and I have done some YouTube videos on stem cell transplantation. And so if you haven't seen my stem cell transplant video, I would encourage you to go on to the channel here and watch that one. I talk about it at some length, but I want to be very clear that it is not a cure for multiple sclerosis. It is a very, very effective means of trying to impact the disease. I think that there are a lot of options for a lot of people, some very high efficacy options, such as Lemtrada, alemtuzumab, which I would consider long before I would consider a stem cell transplant in most relapsing patients. Great question. All right, let's take a look. So here's a question from Nanny, who writes, I have trigeminal neuralgia, looking for some relief. Would Botox help? Yes. So trigeminal neuralgia, the trigeminal nerve, is one of the 12 cranial nerves. So the trigeminal nerve is actually the 5th cranial nerve. I'm trying to show 5 fingers here. And there's a branch up here that's called V1 or 5-1. There's a trigeminal branch here, and there's a trigeminal branch here. And people with trigeminal neuralgia can experience a lancinating, electrical, or sharp pain, which is absolutely described as some of the very worst pain that a human being could ever experience. In French, it's called tic douloureux, and it can be devastating. In fact, it can hurt so bad that there's been cases of people wanting to take their lives because it hurts so bad, which is terrible. It can be very challenging to treat. Fortunately, we can sometimes get a hold of it by using anti-seizure medicines like the carbamazepine Tegretol that someone asked in a previous question. We can use medicines like Lyrica, like Neurontin. There's a host of medicines that we can use. Depakote, we can use baclofen sometimes. And there are some procedures that can help with trigeminal neuralgia. There are surgical procedures that can be done by neurosurgeons. There's gamma knife radiation, which has been successful for some of my patients. There's procedures that can be done by pain specialists. And we have had some success in doing Botox. Now, the person that's doing your Botox needs to be an expert, like my nurse practitioner, Valerie, to make sure that you know what you're doing. That's just not done airy-fairy. That's a great question. Let's look for another one. So here's a question, and we're going to change the scene up. Change the music and change the scene. There's 155 of you online. Thank you. If you guys like this scene, let me know. If you don't like the scene, let me know. A little bit of coffee, never hurt nobody. Any of you who have spent time with me in clinic know that I am a big fan of coffee. Now, this is a question coming from Laura, who writes, hello, howdy. This is the second time that after IV steroids, I feel worse than when the relapse started. Is this possible? I started with my left leg, and after steroids, my whole body was affected. So the goal of steroids, Laura, is to hasten the recovery from an MS attack. And so if you didn't take steroids, we would assume that over many weeks to months that the MS relapse would resolve. The idea is with steroids that it would be much, much faster, that you would get better quicker. And I'm of the opinion that you probably get more better, meaning you quell inflammation. I think that's really important. Now, steroids have lots of side effects. I oftentimes will refer to steroids as a necessary evil. Definitely a necessary evil in that it has lots and lots of side effects. Steroids can make it hard to sleep, cause major insomnia. They can cause irritability. Steroids can make you really, really hungry, and it can make food taste bad. Steroids can make you retain weight. Steroids can make you depressed. Also, there are some rare, scary side effects with steroids, like a GI bleed or psychosis. And steroids can have a massive impact on sugar levels. And so if you're diabetic, you have to have a very careful hand when applying steroids. Now, as a necessary evil, sometimes we need to use steroids to hasten recovery. My opinion, Laura, is that each time, God forbid, someone has an attack, there needs to be a discussion with the treating neurologist if it's the better part of valor of using steroids to hasten recovery. It's not that we always treat every attack with steroids. I think that's a discussion. And I'm sorry that you've had a bad experience with them. I would not imagine that steroids made the attack worse. It's possible that the steroids just didn't adequately impact the attack. And so if the numbness, let's say, was spreading and the steroids didn't put the kibosh on it, then your symptoms would continue to progress. I also want to point out that when you take steroids, they work by changing the DNA of the white blood cell, making the white blood cell less pro-inflammatory. And so when you do that, it helps for the life of the white blood cell, because you've now changed the way the white blood cell works. And that benefit can last literally for months and months. And so sometimes it's awesome. We have an attack, we take steroids, and the steroids make it much better very quickly, but not always. Sometimes the steroids will help over the next subsequent weeks. Another thing I put in here, so Aaron Boster, MD, that's a little thing I tried to figure out. I'm not sure how cool it was. But
Oh,
if you like this
yeah.
one, give it a thumbs up. That was a great question. Becky was asking about Briumvi. So Candy asks, is there a way to get Botox faster than every 4 months? Not really, Candy. It's not safe to give it tighter. It's also not going to be covered by insurance because it's not safe to be given closer together. And so if, for example, someone's getting Botox and it's wearing off, there's a discussion to be had with the Botoxer to see if they can up the dose to see if that can extend it a little bit. Sometimes that can be very, very helpful. All right, we're gonna do our very first MS water challenge. So you know how we do it. When I drink, you drink. MS water challenge. Drink up, guys. Delicious sparkling water here. I want to up your water game. When I talk about being 5 for 5 in your fight against MS, one of those is to eat and drink smart, and that involves upping your water game. I'm going to do that one more time just because it's fun. So remember, when I drink, you drink, and that's the MS water challenge, guys. Let's see. So here's a good question coming from Krishna. Can you explain about periods in MS? Yes, I can. Now, Krishna, I just put out a video last Monday, so less than a week ago, about menopause in MS. And if you haven't had a chance to see that video, I would ask you to check it out because I talked a little bit about this phenomenon in some detail. But in brief summary, when hormone levels change in a woman with MS, anytime the hormone levels change, it can impact the symptoms of the disease. And so when a woman has her monthly menstrual cycle, there's massive changes in estrogen and progesterone. They change like this. And during that period, we can see a temporary uptick of MS symptoms, which is really, really frustrating. Now, sometimes it's very mild. Sometimes it doesn't happen at all. Sometimes it's really, really difficult to deal with. And just as an aside, sometimes we do things that are creative to try to help women manage this. For example, we will sometimes have a woman who is taking oral birth control pills skip the placebo. And so she will prevent herself from menstruating, and she'll maintain her estrogen levels at a high level for maybe 2 or 3 months. And so instead of going through the cycle every month, we go through the cycle every 3 months. And that cuts down on the amount of periods that she has, and that cuts down on some of the side effects. Now, do not start doing that without talking to your doctor. I'm not telling you to do that. I'm just sharing with you some things that we do in our clinic that works very, very well. That was a great question. So let's see, Sarah is digging the music. Thank you very much. I'm trying to change the music up with each scene. I went through and picked some new music. A lot of it is Arabian trap music or Indian trap music. Kind of makes me feel sort of groovy. And so thank you for saying that you like the music. Christine Poole is in the house. Christine, it's great to see you. How often should you have an MRI? So when we diagnose MS, the MRI is very, very important. It's a massive way that we diagnose multiple sclerosis. And once you have MS, I think that the MRI takes on another value, a different value. It's used to monitor the disease, and in specific, it's used to monitor response to disease-modifying therapies. So I like to get an MRI of the brain about once a year. In some patients after the age of 60, I will back off. So instead of doing it once a year, I may do it every other year. I like to get an MRI of the cervical spine about every couple years. And I normally don't image the thoracic spine routinely unless we have symptoms attributable to the thoracic spine. The MRI is one of the many ways that we try to assess how you're doing with multiple sclerosis. The number one way is what you tell us, right? Because you, Christine, you're a Christine expert. Each person is an expert in their own body because you live with your body all the time. And we really need to do a good job, us neurologists, of listening as you talk about the litmus test of life and how things are going. That's probably the most important way, frankly, that we learn about how things are going. The second most important way is kind of a toss-up between structural imaging, that's the MRI, and functional testing. So that's what I call the MS Olympics, when you track all the tests that the neurologist does. That's a great question. So Jane has a question, and I'm going to change up the scene. And so we'll use this scene here. If you like this scene, definitely jump out of the chat and give it a thumbs up.
Oh, yeah.
And Jane's asking a Lemtrada question. How does age or EDSS affect the effectiveness of Lemtrada? So the first comment, Jane, is that we have not really studied Lemtrada in folks formally over 55. Now, that doesn't mean that we don't use Lemtrada in folks over 55, because I certainly do. But the clinical trials data enrolled people in the original trials from age 18 to 55. And so that's the largest group of data that we have. And also, when we enrolled patients in the clinical trials, we did not include patients that were using a cane at the time of enrollment, just to give you some framework. Now, that doesn't mean that we don't use it in people over 55, or we don't use it in people who have a cane, because we certainly do. I'm simply saying that the clinical trials data didn't start collecting that kind of information. If I made a general comment, I think the earlier that you use Lemtrada, chronologic age, so the younger you are, and the lower the EDSS at the time you use Lemtrada, the more effective it appears to be. That's my own experience. I want to be very clear, however, that that doesn't mean it doesn't work, because it absolutely can work in someone who has more advanced disability. There's case after case after case of this in my own clinic and in my friends' clinics around the country and around the world. And I don't believe in being ageist. I do think that Lemtrada is harder to handle if you happen to be a little bit older. And so that's a great question. It's time for the MS challenge. So when I drink, you drink. You know how we do it, guys. That stuff is good. Larry says the music is fine. Thank you. This song is called the Arabic Trap. Kind of a fun song. And Larry, I appreciate that. Thank you very much. All right, let's see what else we've got cooking here. So Carol asks, is there a projected date that the BTK inhibitors will be available? I'm on Ocrevus, but my doctor says my IgG levels are too low and put Ocrevus on hold. So a lot of things to unpack here. First of all, when you take a B-cell depleter, Ocrevus, Kesimpta, Briumvi, Rituxan, there's a chance that it'll drop your IgG levels. And if your IgG levels are dropped, there may be an increased risk of infection. I say may, it's not a guarantee. But I can understand if they were too low, and particularly if there's other risk factors, the doctor may become apprehensive because we don't want to expose you to undue risk. And so one option is to space out the Ocrevus, to do it less frequently. Another option is to add IVIG. So adding IVIG can be very, very helpful to prevent infection and boost up the IgG levels. Now, as far as the BTK inhibitors go, it's going to be a couple years. So there are clinical trials ongoing for Sirona with evobrutinib, with Sanofi with tolebrutinib, with Genentech for fenobrutinib, with Novartis with remibrutinib, and in fact, Biogen just jumped into the mix with a phase 2 trial. Now, the first 4 that I mentioned are phase 3, and those, when they wrap up, will be collecting information to go to the FDA. The Sirona trial is the farthest along. The second farthest along is the tolebrutinib trial with Sanofi. And it's going to still be a couple years before we get all the clinical data. My point here is, Carol, I would not wait to do the BTK inhibitors because we're not going to see them FDA approved for several years. There's 180 of you online right now. That's awesome. Thank you very, very much. If you are liking the new format, let me know. I hope that you do. I took a lot of time to try to kind of reframe things. And let me know if you like these scenes or which scene is your favorite. If you find the music to be too loud or too soft, definitely let me know that as well. All right. Also, of course, remember...
Oh, yeah.
Give things a thumbs up if you don't mind. It lets the YouTube algorithm that you know like what's going on. So Kate Meyer writes, I'm getting muscle cramps in the arch of my foot. Muscles actually push out. I'm taking magnesium, and I have some great THC cream, but it's still happening. Any suggestions? Yes. Number one, I want you to stretch. So you can stretch your foot. The easiest way to do that is to grab a tennis ball and to put your foot on top of the tennis ball and roll the tennis ball around. That will push on those muscles. That's an old physical therapy trick, very, very effective. You can also stretch your foot out. So you can put a band around it and pull, or you can put a strap around it and pull. Massage can help your foot. And so I would stretch your foot out, or I would roll on a tennis ball 3 times a day minimum. It can be very, very helpful. You may notice that if your foot gets really cold, that it gets worse. And so keeping on warm socks, keeping yourself from walking on cold floors by wearing socks, etc., can be very, very helpful. You can see my son's cat in the background, Mewtwo, walking around. Other things can be helpful. By talking to your doctor, there are prescription medicines that can be very helpful. I use a lot of baclofen to help with foot spasms. There are other medicines like Xanaflex, tizanidine that can be very helpful. And Botox can be very helpful. Now, it's a bit uncomfortable to have Botox on the bottom of your foot, and so we sometimes use a numbing cream, but that can be very, very helpful in trying to deal with discomfort from spasms and cramps. Great question. Cheryl says the music is fine. Thank you very much, Cheryl. I dig that. All right, looking for more questions. So Even So It Is Well says that she's stretching right now. If you guys are not familiar with, she has a great YouTube channel. And so definitely check out Even So It Is Well. Her YouTube channel is superb. So we want to give a shout out to my fellow YouTuber. All right, let's see what else we've got cooking here. Amanda writes in and says, I have generalized uncontrolled epilepsy. MRI shows radiologically isolated syndrome. Inflammatory check, no knee or ankle reflexes, not in the CNS. So it's a little bit hard to give a detailed analysis here, Amanda. It's a very specific question to you, and I don't have enough information. I would need to be able to see the EEG read, and I need to be able to see the MRI. I definitely want to make sure that you're in the hands of an excellent neurologist who can help decode and understand what's going on. I wish you the very best of luck. So Amal Abdul writes, is it true that anyone living with MS longer than 8 years is now clinically categorized as progressive? No, that's not true at all. I think that's absolutely false. Great question. So this song is called Trap Hip Hop. Let me know what you think. If it's too loud, let me know. I'll turn it down just a smidge, just in case it's a little bit too loud. I dig this music. So T-Mom, forgive me. T-Mom asks a great question. Says, hi, Dr. Boster. Well, hello, T-Mom. Great to see you. Why do you back off an annual MRI after the age of 60? Now, this is actually a discussion. And so if my patient wants an annual MRI after 60, I'm not going to tell them, no, you're not allowed. But statistically, you are less and less likely to have new MRI lesions as we get a little bit older. And I'm not suggesting that 60 is old, because to me, 60 is the new 40. But if we have had stable MRIs for years and years and we reach the age of 60, I will discuss starting to do it less often, like once every 2 years. And again, that is a discussion. So I have plenty of 60-plus-year-old folks where we're getting scans every year. I have other folks where we're doing it every 2 years. I just really like this music. Somebody said way too loud. All right. So Bluthton is throwing forth a question from Daniel. And so Daniel's question is, what helps with myelin sheath repair? Right now, we don't have a good answer for what helps with myelin sheath repair. There are several drugs that we're trying to study, like clemastine, which might help with remyelination, but we have been unsuccessful thus far in trying to find something that routinely does that. Sorcha said the music was a little too loud. So hopefully this is a little bit better. I turned it down some, and I super appreciate the feedback, guys. Hopefully this is not so loud. All right, looking for more questions. So this is funny. Someone's being sassy. So Common Sense Prevails is being a little bit sassy and says, why Why do you ask if you are going to ignore the answer? Okay, so I'm not exactly sure what's going on there. Other than steroids, are there things that can help flare-ups naturally? My doctor, for some reason, doesn't want to give flare-ups for more than 3 days. So there are risks with steroids, and there's different kinds of steroids. There's a medicine called Acthar, A-C-T-H. Acthar can be used when steroids are not safe. And there's other things you can do like IVIG or pheresis, although those can be really, really involved. Bluthton said the music's better. Thank you, friend. Again, this is all an experiment, trying to do some new things here. I hope that you guys like it. If you haven't yet left the chat and give it a thumbs up.
Oh yeah.
Please go ahead and make sure to give it a thumbs up. That helps the YouTube algorithm quite a bit. So here's a question from Lori Domino. And Lori writes, let me see if I can see the full question. All right. If a patient is relapse-free for 10 years on Copaxone, should they still switch to a more effective medicine? So that's a very good question. And the reason I like that question is MS is not just about attacks. So not having attacks is very, very good, but that's not the only thing that we care about in the setting of MS. And we need to be thinking about attacks, yes. We need to be thinking about new spots on MRI. We need to be thinking about black holes on the MRI. We need to be thinking about brain volume on the MRI. We need to be thinking about disability progression. So if you tell me that all of those things are awesome, then I think there may be a discussion about staying on Copaxone. But I don't just want to make a decision exclusively based on attacks. I don't think that's the right way to play this. There are 186 of you that have jumped online, and that's amazing. Thank you all very much. I spent the week kind of revamping the live stream here, and so I was really excited to test it out and see what you think, and so thank you so much. We're going to do, you know what, the MS Water Challenge, so that I drink you bit. So here's another really good question from Tic Tac P. So Tic Tac P writes, can MS cause deconditioning? Absolutely. Not from not moving, but as a symptom of the disease. Well, I think that's interlaced. So when you have MS, it makes it very hard to stay in shape, right? Because you can't just like go out and run necessarily. And neurological symptoms can make it very hard to stay in shape. And so I think as a result, people are at higher risk of becoming deconditioned. It's kind of a double whammy. You can have a weak leg because of MS damage, and then because of the weak leg, it's hard to exercise, so then you get deconditioned. You can see both things. That's a very good question. Thank you for asking it. Sorcha says, I have physiologic bradycardia, which is doctor talk for she has a low heart rate. Drops to 35 when I'm in deep sleep. Resting heart rate can be 50 to 55. So if you're not symptomatic, that's generally not a problem. Now, if you're symptomatic, like you get lightheaded or have palpitations or pass out, then that can be a problem. And so you definitely want to get with a doctor who can kind of help sort that out and make sure that you're safe. And there are medicines that can be used if necessary to kind of adjust that, no question about it. So Colleen says softer music would be helpful. And so thank you for that feedback. And I'm always on the lookout for good music. I love this trap music, but if it's too much, then I appreciate that feedback and we'll see what else we can do. So I'm not gonna be able to pronounce this name correctly. Janani writes, can we prevent progression of multiple sclerosis through food? No. I don't think that a particular diet can, by itself, can stop progression. I do think that a diet is important. I think a diet can be very, very helpful in minimizing symptoms. I think that a healthy diet can contribute to slowing down the disease, but you can't do it just with food alone. And so I think that eating smart is part of the picture. Exercising is part of your lifestyle, not smoking stuff. Eating smart. Mindfulness, taking the most effective disease-modifying therapy possible. This is a complete package. It's a multi-pronged approach to try to beat the disease. But I don't think one thing by itself can do it. Sorcha says the music's better, and we just hit 200 people on this impromptu live stream. Thank you very, very much. That's amazing. I really, really appreciate that. Yay, thank you. If you haven't yet given it a thumbs up, please.
Oh yeah.
Go ahead and jump out of the chat and give it a thumbs up and jump back in. I've done a lot to change up the scenes today, so let me know what your favorite scene is. Leave it in the comments, and when this live stream wraps up, I will definitely check that out. I'm very excited to kind of see what you guys think. If this music is too loud, let me know. I'll turn it down a little bit. There are a lot of hearts right now. That's so awesome. Thank you very much for the hearts, and thank you for the love. I say this with very significant sincerity that this YouTube community is amazing. I've told you before that when I started making YouTube videos, I didn't really know what I was doing. I just wanted to educate and empower and energize people impacted by MS, and I really wanted to educate my own clinic patients in between clinic visits. But I didn't realize that we would create this amazing global growing online village. There's 52,000 subscribers, which is unbelievable to me. And I look so forward to doing these premieres where I watch videos with you. I look so forward to reading the comments. I read through all the comments that you guys write, and it's amazing. And I love these live streams because I love interacting with you. So it's really, really cool. And so thank you for that. All right, what else is cooking here? So this is a really good question. And I'm concerned I'm not gonna be able to pronounce this name correctly. Juvenile? So if I said your name wrong, I apologize. Juvenile. It's okay to have MS symptoms without new spots on the MRI. So it is possible that you can have new neurological manifestations without a clear new spot on the MRI. That is possible. It doesn't always have to be one-to-one. I see this all the time. I think it's not accurate to assume that every single type of pathology in MS is always caught on the MRI, because that's not the case. Good question. This is a wonderful and very important question that Laura asks. Do you recommend exercise during a relapse, or is it better to rest? And I think you have to read your body. And so if you have a relapse and exercising is going to make you fall, of course we don't want you to fall and hurt yourself. But I don't think that you're going to make the relapse worse by exercise. I have a lot of patients where exercise is a very important antidepressant. Exercise helps increase their energy. Exercise decreases their spasticity. Exercise helps them sleep better at night. And if you're one of those people and you feel like you can get a good walk in or do some exercise, I don't think it's going to make your MS worse. I do think that you have to use common sense, obviously, and I don't want you to push it and then fall, God forbid, or something like that. That's a really, really great question. Thank you for asking that question. Sorry, I like this music. All right, so this is the funky trap music. I'm not sure if it's too loud, so let me turn it down a little bit. If you like this scene, definitely give it a thumbs up. Let me know.
Oh yeah.
I love the hearts, guys. Thank you very much. Next question is coming from, I don't know if I can say the name, Zoyander Street. So Z writes, wonder if the software you're using has any plugins that would allow automatic captioning. I don't know. I'm not very good at this, if I'm honest. This is like my very best efforts at trying to make this work. I'm using a software called OBS. Right now, where your question is popping up on the screen, that's a plugin. And so I'm not sure about how to do that. If you have any suggestions, let me know, because I'm always trying to learn. And to be very honest, it's kind of a hack and slash approach, because this is tough for me to try to figure out. All right, looking for the next question. Lioness says, do you have a colleague at OKC? So there's a guy named Dr. Gabe Pardo out that direction, one of the best MS neurologists in the country. That's a good friend of mine. I love that guy. So if you look up Dr. Gabe Pardo, I would drive to see him. He's phenomenal. Brilliant, brilliant man. Also a really, really nice guy. Doug is here, coffee in hand. Doug is an OG, been around on this channel since the beginning. Doug, thank you very much for being here, one of our moderators. Says the new format and music volume is going okay. Thank you for the feedback, and thank you as always. I love your comments. They make me smile. I really appreciate you. Luca saying hi from Serbia. I spent a week in Serbia years ago at an MS Congress, and it was a really, really awesome experience. So thank you for being here today. All right, so what makes sense, shares. Went 6 months between follow-up, 9 lesions on the brain. Symptoms, doctor said no DMT until symptoms worsen. I personally do not agree with that. I think that the earlier that we treat, the better that you do. In fact, this coming Monday, I have a pretty intense discussion. I made a video, did a discussion with a guy with MS who's also a YouTuber, Dominic. And so check out my Monday video coming here in a couple days, where I really discuss this exact point. So Marissa says, have you seen disability improvement with Lemtrada? Yes, I have. Now, does that guarantee? No, it's not guaranteed. But I would say of all the drugs that I've used to treat MS, I have seen the most disability improvement when using Lemtrada. I think statistically you got about a 41% chance of having clinical improvement. All right, let's see what else is cooking with questions. Now, yeah, I got another scene here. Let me know if you like this scene. Let me know if the music is too loud. So Martha asks a question, just curious whether a birth control pill can trigger MS. No, it can't. In fact, there's some data to the contrary that oral estrogen supplementation may actually help MS, but I don't think it can hurt MS. So there's a lot of hearts. I hope that means that you like this. You can see that guide changing the channel, and I'm so excited to be here with you guys, and I'm so excited to try out these new scenes. So thank you for being here with me. So, gosh, I'm worried I'm not gonna be able to say this name. Mahashwari. So, M writes a really good question. Hello, really nice to meet you. I'm sorry if I said your name wrong. Mahi, maybe I can just say Mahi. Can you please suggest about bowel movements with multiple sclerosis? So people impacted by MS can have very significant problems with bowel movements. That's part of the down theres. And if you would like to make an adult frustrated or really, really impact their quality of life, make them constipated. It's just a terrible thing. And so a lot of people impacted by MS have slow gut transit. They also can get really constipated. Sometimes people with MS have an IBS syndrome where they have constipation and diarrhea, which is also horrible. And so there's a lot of things that we recommend. Exercise helps with bowel movements. So going for a walk once a day, if you can really, really help you move your bowels. Avoiding certain foods like nuts and cheeses and heavy meats, those can help avoid constipation. And so upping your fiber game, so 28 to 35 grams of fiber a day. And fiber does a couple things. It bulks up your stool, which when you add water, makes it big and bulky and easy to hold on to and then easy to pass. And fiber, a lot of fiber is a prebiotic. Which is fancy talk for it feeds the microbiome, the bacteria in your gut. And so I oftentimes recommend that people impacted by MS take a fiber supplement or make sure that they have at least 38 grams of fiber through their diet. Taking probiotics can really help with bowel movements. And so probiotics are pills or foods that have healthy gut bacteria. So kimchi, sauerkraut, pickled eggs, these can have high healthy gut bacteria, or you can take a probiotic pill. And so probiotics can be very, very helpful. There's a lot of things that we can do for gut health. There's medicines that we can use for gut health. And there's some behaviors that can be very helpful for gut. So for example, When you wake in the morning and you have your first hot tea or hot coffee, and that hot beverage hits your gut, hits your stomach, there's something called the gastrocolic reflex. So when you stimulate the gastro, then the colic is stimulated, and about 15 to 20 minutes after you have that hot beverage, your bowels will try to evacuate. You'll try to have a bowel movement. And because of MS, you may no longer receive the signal, but you can just remember, hey, it's been 15 minutes after my first coffee, or I'm gonna go sit on the john and try to have a bowel movement. I've got a lot of videos on this channel about how to improve gut health with MS, so I definitely would check those out. Now, again, we're changing up the scene, and let me know what you guys think. If you like this scene, definitely throw some hearts in the chat. If you had not given it a thumbs up, then please give it a thumbs up. But show me some hearts if this is a scene that you like. Thank you for the hearts, that's really fun. I've got a question here from Joan. So Joan says, do you have any MSers with HIV? Absolutely, I do. Treated with antivirals who get relief from their MS symptoms. Yes, so in the real world, people can have more than one thing going on, and sometimes nature's too generous, and I certainly take care of people who have developed HIV and developed MS. The highly active antiretrovirals work very, very well for HIV. It's revolutionized HIV care. And so we can still treat them with MS medicines. Now we have to be careful because we don't want to suppress the immune response, but there's plenty of MS medicines out there. I tend to use Tegretol, Vumerity, Copaxone, those kind of medicines, which are immunomodulatory in nature, and they don't really suppress the immune response, but we absolutely can treat both, no question about it. HIV neurology is a very involved field in and of itself, and so I do think it takes a careful hand, but the answer is absolutely yes. That's a really, really good question. So some feedback here. One life to live. When the special effects come through, your volume is drowned out. All right, thank you for that. I'm not exactly sure how to fix that, but I'm going to look into it. So thank you for that feedback, and I will try to sort that out. Let me just turn the music down in case that's a problem. And I appreciate that feedback very much. So here is a question from Amy. Amy writes, antidepressants that don't cause weight gain as a side effect. Yes. So there are two antidepressants that I find to be the most helpful for not avoiding weight gain. One of them is Wellbutrin. I love me some Wellbutrin. It can actually cause suppressed appetite. Now, Wellbutrin's not for everyone. It can increase anxiety in some patients, and it can lower seizure threshold in some patients. And so, obviously, we need to make sure that it's safe for you. But that's my fave when trying to avoid weight gain. Sometimes we can use a low dose of an SSRI or SNRI, and we can get away without having a lot of weight gain. Some medicines like Paxil are notorious for causing some weight gain. Sometimes we can add things like Topamax, which can help promote weight loss. Absolutely. So Luca asks about Mayzent. So Mayzent is a second generation Gilenya. It's an S1P1 receptor modulator. It's a pill that you take. And it's a lot like Gilenya, in my opinion. I don't see massive differences in my experience using Mayzent as compared to Gilenya. A lot of patients, because here in the United States, Gilenya has become generic, have gone from Gilenya over to Mayzent, and to me that's a lateral move. I'm a little bit disappointed in the disability progression data for Mayzent. That's just my opinion. That doesn't mean it's not a good drug. It is a good drug, but it's not one of my go-tos. So Kathleen asked this question during the last live stream, and I missed it, and so I'm going to try to address it now. Kathleen Bradley's asking about pudendal nerve issues in MS. So the pudendal nerve is a nerve that provides sensation to the down layers. And sometimes you can have pudendal nerve involvement. The spinal cord is actually the problem, and it can cause pain in the down layers or numbness in the down layers. And that can be very, very significant. Sometimes we have to get pain specialists involved to do nerve blocks, or surgeons to help with moving nerves around, or spinal cord stimulators. I've had some good success with spinal cord stimulators to address pudendal nerve pain. That's a really good question. Did he answer? Maybe get a second opinion. So I think that was an ongoing discussion that maybe I missed. Not sure what's going on there. Laura says, I love your videos. Thank you very much, Laura. I really appreciate that. Check this out. I thought this was fun. This is an old TV set scene. Thanks for allowing me to goof around here. T-Mom says that I'm a benefit to the MS community. Well, thank you very much for saying that. You know, many of you know that I decided to be an MS doc when I was a kid because my uncle had MS and was poorly treated by MS neurologists. And so I told my family that I would learn to do it a bit better. And I've been very mission driven, trying to educate, energize, to help really raise the bar with families impacted by MS. And this YouTube channel is my attempt at outreach to create awareness and educate. You know, I don't get to see everyone with MS. That's not plausible. And so if I can create a YouTube video that you can then watch in the comfort of your own bathroom at 3 in the morning, and that ups your game, that means a lot to me. So thank you for the very kind words, T-Mom. I really appreciate that. So A Pepper writes, so far we like the mirror scene and the TV scene's the best. And you appreciate that I turned down the music. Oh, you're very, very kind. God bless. Thank you. I appreciate getting to interact with you quite a bit. All right. So Daniel writes, there's a lot of negative comments about drugs. Side effects of Ocrevus. Not feeling comfortable taking this drug. So Daniel, you know, it's been my experience that people don't write on the bathroom wall if everything's okay, right? So when you go onto Facebook, nobody's going to say, took Ocrevus, was boring, right? Because that's not Facebook worthy. They're only going to write on Facebook if you grew wings and flew, or if you had a really bad experience. And so it's a very, very biased perspective. You know, people don't write positive comments very often. A lot of times people only share when they're upset. I can tell you that I've given a lot of people a lot of MS drugs, and I see a lot of good. And I think the risk-benefit has to be weighed. I would be very, very cautious about just looking at reviews online. This has actually been studied, and it's a super, super biased environment. Now, I've been waiting for this scene because I wanted to share with you guys some stuff. So let me make a comment here. So, Boster MS Center in the regional news. So, what I want to do here, we recently have been meeting with Channel 4, which is a local news station here in Columbus, Ohio. And so I wanted to share with you some of the videos from the news station. And so if you guys, these are short videos, they're just a couple of minutes each. And so let me know what you guys think, and let me make sure that you can hear them okay. Ready?
You know, all too often, personal passion comes from enduring a struggle or seeing a problem without a solution. For Dr. Aaron Boster, it was watching his uncle suffer from multiple sclerosis before real treatments existed. And since then, he has set out to change the journey for anyone with MS, recently opening his own clinic, the Boster Center for Multiple Sclerosis. So I have Dr. Boster and therapy dog River, who is sitting with us. I know, look, she hears her name and she perks up, but that's part of the charm of River. So Dr. Boster, thanks for being here.
Thank you so much for having me.
All right, let's start with some education. If you have not, been in that world and loved someone who has MS, you might not know even what it is, what it does to the body. So give us a synopsis.
Absolutely. So to understand MS, we have to think about the immune system, which is the part of the body that fights off bad guys. And so when your kid sneezes on you and you get a virus, your immune system beats the virus. But you're not supposed to have any friendly fire. So the immune system is supposed to leave the parts of your body alone. Now, every once in a while, the immune system makes an error in judgment, and it identifies part of you as a foreign invader. And so you've heard of diabetes.
Sure.
That's an autoimmune disease where the immune system attacks the pancreas. Multiple sclerosis is another autoimmune disease. The problem is it attacks the holiest of holies, the supercomputer that runs the body, the brain, and the spinal cord. And where those attack occurs kind of determines what the human being experiences. God forbid there's an attack of the optic nerve, they're not going to see out of that eye.
Okay, I understand that. You know, I was just discussing with you two. I met you a few years back. You were the clinician champion for the MS Society, which was incredible. But back then, it was just incredible, I think, to meet the people, the patients, the people that are, you know, the other fellow physicians that were in the room that just rave about how you are with your patients. And I think that, you know, there is a lot to be said about that, right? When somebody is going through this moment and they are in such despair, and you walk in.
The goal is to help a family live their very best life despite having MS.
Yeah.
And I want to bring every tool that we have to bear. I tell people, I want you to have the biggest village possible, and we want to be village members. And really, in the modern era, with an early diagnosis and the earliest application of the most effective medicines, we can make MS boring. You can live a full life, a meaningful life. You can do the things you want to do and not let MS make those decisions. And so that's what we try to do.
I love that. You know, the Boster Center for MS is fairly new, right? I mean,
That's right.
you were a practicing physician for many, many years before you decided to go out on your own.
That's exactly right. You know, I've enjoyed caring for families in my hometown of Columbus my entire career, and I decided it would be a great adventure to set up my own shop, and we launched 2 days before the governor closed the state of Ohio. So March 18th, 2020, we opened up, and we all know how that played out.
Yeah.
I'll tell you what, though, it's been an amazing adventure, and I'm so proud of my team in Columbus here. We're caring for about 1,400 families in this area, and it's really an honor. It's been a wonderful, wonderful experience.
Yeah, talk about that, because we're looking at some just, you know, images of the clinic and obviously what you do for folks on the daily, but River is one of those tools too.
That's exactly right.
So how does River play in? What are you trying to do for these families?
Someone comes into the clinic, and it might be one of 20-some patients or families that we're seeing that day. But for that family, it's the first time in 6 months that they've seen us, and it's a really, really emotional time. And a lot of times we're looking at a brain MRI, we're receiving a chemotherapeutic. You know, these are intense things.
Yeah.
And so creating an environment that's not sterile and ugly and unpleasant is very important. You know, our clinic is located in the woods, so you can look at the forest, and having my dog makes receiving a therapy a little bit easier to tolerate.
And what do you want people to know too about the center and what you're trying to do about it that may be different than, you know, another center or a place that they're, you know, they know or they've heard of before?
There's a lot of great opportunities for MS care in Columbus, and so the families here in Columbus are very, very in good standing with lots of different clinicians. I think at the Boster Center for MS, we want to be a family member, we want to be a team member, and we're going to work with you to understand your family's goals and help you live your best life. And so when you talk about personalized health care, it's really what we live and breathe, trying to figure out what makes you tick and how we're going to keep you ticking and not let MS make any decisions.
You are a vibrant human, I think. Just walking in a room, everybody turns to you. They are gravitated towards you. And you even do a YouTube series, which you've done for a long time, and I think it's great.
Thank you.
Yeah.
You know, I realize that everyone has social media, and if you come see me in clinic and I want to tell you something important, it might not be the best time for you to hear it. You know, it might be overwhelming
Certainly,
for you.
yeah.
So if I record it on YouTube, you could watch it at 3 o'clock in the morning in your bathrobe in the privacy of your own house. That might be the good time to receive the information. And so we have really leveraged YouTube as an educational tool to help up people's games.
I
Plus,
dig
it's
it.
kind of fun.
It's fun. It's fun. It is great. So if somebody is out there too, and you know they're already obviously dealing with the diagnosis, or they are new to the diagnosis, how do they get in touch with the Boster Center?
It's not hard.
Thanks, guys. I'm very curious if watching that video is something that you're interested in. If it is, I would love to come back and show you more. These little clips with the local news channel are special to me, and you guys are really special to me, so I was excited to share that with you. So let me know in the comments if that's something you want to see. I actually have several more that are already loaded, but I want to jump back into some questions. And I also have to take a bio break. So there's 190 of you that are online right now, and I'm going to ask you to stay put for a second while I sprint to the bathroom because I've got a near 50-year-old bladder, and then I will be right back. That way we don't have to jump offline. Don't run away. I'll be right back. Quick bio break. All right, talk amongst yourselves and enjoy the music. I'll be back in seconds, guys. Thanks for not running away. Woo! Thanks for not running away. Got my hands washed and got back here as fast as I could. Thank you for being understanding. Let's jump back into a discussion. If you guys liked watching that video with me, let me know in the comments. I can even show you another one today if you're not too bored with it. And I would love to hear kind of what you think. Let's take another couple questions and then we'll revisit that. So J Max says, just ordered my pro and prebiotics, about time. Good job. I take a pro and a prebiotic and I think it helps me quite a bit. You guys can see my dog River in the background here. This is really fantastic. Let me see what other kind of questions we have. T-Mom said that you enjoyed the video. Well, thank you. I really appreciate that. It was fun to try to be able to share that with you. Let's look for some more questions. Can you go to full screen, please? Sure, I can do that. Let's see here. How about this? There's 189 of you that has stuck it out, and I really appreciate that. Let's do a little MS water challenge. You know how we do it. When I drink, you drink. And wanted to change up the scene just a little bit. What other questions do we have in store here? If this is too loud, let me just turn it down a little bit. Let me know if the music's too loud or if you like this scene. So here's a really interesting comment from Diana, who says, I was against the Apple Watch, but it'll call if I fall, and that's a great idea. Yeah. Technology is amazing, and having an Apple Watch or another device which can detect falls is not a bad idea. I really think trying to figure out how to use and leverage technology to up your game is brilliant. So thank you for sharing that. All right, here's a comment and question from Firuz. On Ocrevus for 2.5 years, no new spots on MRI, but have had progression of disability. Should I speak with my neurologist? So we now refer to this as PIRA, progression independent from relapse activity. And we know that this can happen with any of the MS drugs. It's my opinion that Ocrevus is amongst the very best slowing PIRA, progression of independent relapse activity, but that doesn't mean that it's not worth having a discussion about whether there might be something that's working better. Jim is concerned that the house is on fire. Jim, I'm going to put that fire out as soon as we switch scenes. Thank you for that. If you guys like this scene, definitely throw some hearts in the chat so I can figure out which ones you like and don't like. And if you haven't yet, definitely give the live stream a thumbs up. That lets the YouTube algorithm that you really like what's going on. And Laura says, I just prefer your face. Oh, that's very, very sweet. Maybe we'll change it up this way and see what you think about this. So Shell asks, do you take new patients from out of state? And so, during the pandemic, I did a lot of things on telemedicine. Now that the pandemic laws have kind of gone back, I can't do out of state the way that I used to. And so I need to do the first consult in my office. I do have a compact license, and so I now have a license in several states, Tennessee, Indiana, Illinois, West Virginia, Michigan. There's a lot of different places where I am able to see folks. And so if we establish care in the office, then sometimes we can do some telemedicine. Let's take another question here. So we've got a question from Ashley V, who writes, most of my lesions are in the spine. The doctor said that was uncommon. What do you see in your practice? How do you treat them? Tested for enema, which is negative. Well, Ashley, I've been seeing a lot of MS patients for a very, very long time. Some patients have mostly spots in their brain. Some patients have mostly spots in their spine. So I don't think that's uncommon. I think that you can see that. And what does that mean? I think it means we need to be very, very aggressive in your treatment. I want you on the most effective treatment that you're comfortable with. The spine is holy area, and so we want to prevent spine lesions at all costs. Also, the types of symptomatic care that we provide may be slightly different. We may need to focus more on the bowel, the bladder, the bedroom. We may need to focus more on spasticity and balance and things like that. All right, so Kevin writes, I get leg spasms when I lie down. Is there a good treatment? No drugs if possible. Yeah, so number one, I want you to stretch before you lay down. So literally, Kevin, you should spend 10 minutes stretching out your hamstrings, your quadriceps, your calves, your butt, your back, your hips. This is very, very important, Kevin. And if you can do that, you want to hold each position for at least 30 seconds, all right? Because otherwise your muscles don't really figure out what you're trying to accomplish. And I want you to do several sets. You will find that that cuts down on spasticity big time, seriously. Very, very helpful, doesn't require medicine. All right, what else do we have cooking? So a lot of great comments here, a lot of hearts in the chat, a lot of flames in the chat. You know I love the flames, guys. All right, let's see what else we have going on. So Claire says, how immunocompromised is someone with Ocrevus? Not very. Yes, it can suppress the immune response, but it suppresses a sliver of the immune response. So let me turn down the industrial sounds here just a bit in case that's a bit too loud. So if you think about the immune system, you have the innate immune system and the adaptive immune system. And Ocrevus doesn't touch the innate immune system, just the adaptive. And if you think about the adaptive immune system, you have the B cells and the T cells, and it doesn't touch the T cells, just the B cells. And if you think about all the B cells, you've got stem cells, and then you have adult cells, and then you have some specialized cells like plasma cells. It only affects the adult B cells. So you're really suppressing a sliver of the immune response. And we can do some things like check laboratories to be able to tell you with some authority if we've pushed your lymphocyte count too low, or if we've decreased the antibody levels too much. And so I think that having those kind of labs a couple times a year can be very valuable. Do I think that you need to wear a mask? Not necessarily. I increasingly am wearing a mask when I'm in certain public spaces, like when I'm on an airplane. And I don't have MS, I'm not immunosuppressed, but I think it's a good practice. But no, I don't think that it's an absolute requirement. I think it's a really good question. All right, so I want to try to jump back to show you another video. All right, I'm going to show you another one of the videos that we did with the local news channel. And let me know in the comments if you like this or dislike this. I see that some of you are logging off, so maybe that means you don't like it. But let's just see what happens here.
As anyone with a chronic illness will tell you, long-term treatment can be an ever-changing dance. What works well 1 month can offer little. As anyone with a chronic illness will tell you, long-term treatment can be an ever-changing dance. What works well 1 month can offer little relief the next. And when it comes to multiple sclerosis, no two treatment plans really look the same. It's why the Boster Center for MS is so heavily involved in research. So here to share more in this sponsored segment, we have the center's founder, Dr. Aaron Boster. So good to see you again.
Thanks for having me back.
You know, I think it's interesting when you founded the Boster Center, you wanted to create a space, create treatment beyond what was expected.
Exactly right.
What does that mean?
It means that providing what's currently available is not adequate. In order to beat this disease, we need to partner with people impacted by MS to help develop new therapies. And it's an honor, really, at the Boster Center to be able to bring Columbus cutting-edge opportunities, to allow ourselves to partner with patients to help discover the next therapy breakthrough.
I was going to say, I love that you said partner with patients, because this isn't just the scientists, the doctors, the people in the background that are doing, you know, the scientific aspect of this, right? It's
That's
the
exactly
people.
right. Think about this. If no one with MS ever volunteered to participate in a clinical trial, we'd have 0 therapies available.
Yeah.
Presently, we have therapies available because people that came before us were willing to volunteer the most precious thing they have, their bodies, to help us discover the next best thing.
And a big part of that, I will say, in being involved in active research is probably important to the patients that choose you as well, right? I mean, when they're coming in, they want to see that you are on the forefront, that you're looking for what's next.
You know, sometimes it's adequate to get your disease treated, and there's nothing wrong with that, but sometimes you want to fight back and stick it to the disease. And there's no better way to do that than to volunteer for a clinical trial.
What if during that research you find the patient is responding well? They are doing well. Can you continue with that when you talk about a clinical trial? Because some people are very hesitant, you know, to say, well, what if this works and then I'm left without it?
So that's baked into the trial. When you do, let's say, a 3-year clinical trial and it ends, you're then offered the opportunity to do what's called an open label extension, where it's no longer an experiment. We give you the drug and you know you're on it, and then we continue to follow you indefinitely.
Nice.
So those people aren't dropped off, they're allowed to continue, and that's really very special.
What also is important is those who've hit a roadblock in treatment. We've seen this a lot when somebody has been doing a treatment for many years or even months, and all of a sudden they're not seeing results.
That's exactly right.
Right?
And so creating options is the name of the game. And fortunately, in 2023, there are many options, but not all of them work for not all people. And so being able to open up the books and look at opportunities for primary progressive MS, secondary progressive MS, for children with MS is so very important. And that's what we offer at the Boster Center with ongoing clinical trials.
And the point is, there is always something new, right? There is always a mix of therapies that you can offer. So, you know, talk about how that, I guess, relates. If you have clinical trials that you've been through, right, and you're looking at these successes, are you then able to tell your patients, hey, I saw this work in patient A, B, and C. Let's bring that to your treatment plan?
That's exactly right. And so if we are successful with the trial, it now opens up the opportunity for all people impacted by MS to benefit from that trial.
Yeah.
And so that's how we bring new drugs to market. And it's a very exciting experience. And being able to offer that here in Columbus means the world to me.
Where are we at right now, Dr. Boster, when we talk about treatments for MS? If somebody is diagnosed early, right, and they say, what's out there? What can my life expectancy be? What can I expect to live with?
If we play our cards right, if we have an early diagnosis and we're aggressive with treatment, we can make this disease boring. So we can't cure MS today, but we can't cure a lot of conditions. But we can make it boring where the MS doesn't get to choose what happens, and you can live your best life despite having the condition. And that's really our goal.
Yeah, and so when you talk to people, and you have to figure out obviously what type of MS they have as well, I don't think a lot of people are familiar with the fact that there are differing types of this
That's
disease.
exactly right. And we make sure when we're offering clinical trials that we have something for everyone. We have registries where we literally will record and document your experience so that we can learn from your experience. We have clinical trials testing new therapies for all the different kinds of multiple sclerosis. So that way nobody is left out, and if you want to fight back, we can help you do that.
And are you able to then share that data with other offices and maybe other patients and things like that, or you hope that that would be what comes out of it?
In time we can. Now during the clinical trial it's hush-hush, all right?
Yeah.
But once it's released, then it becomes public, and that's a very exciting time. It's kind of like opening up a Christmas present.
Right, because you want everybody with it to be helped in the end. That's the whole point.
That's the goal. That's exactly right.
And then I want to mention, because we do have a friend down here, River. I don't know if you can see her. She's obviously the most calm dog ever, and she joined you last time, but she is there for a lot of the treatments, and we've seen some video of your patients, and that's part of this whole thing too, is that your office is such a welcoming, calm environment.
If you have to have MS, we want to be your partner, and we don't want it to feel like you're in a hospital, you know, and so having my dog present just makes it that much better.
Makes it that much better. I said, when I walk in, she is the only dog that doesn't jump on you. She is just calm, and she says, you come to me if you want.
Exactly
I'll
right.
let you pet me.
Exactly right.
I love her. Okay, Dr. Boster, I want to let people know then how can they reach out to you?
Thank you for letting me share that with you guys. Again, I'm trying out some new things on this live stream. Let me know in the comments whether it was fun to watch that with me or whether that wasn't your thing. A lot of great discussions going on in the chat. A lot of discussions that are very, very valuable. So Sorch is talking about an AFO. Let's talk about an AFO for a second. What is an AFO? So an AFO is an ankle-foot orthosis. That's what that stands for, ankle-foot orthosis. So if we use my hand and pretend this is like a leg, okay, so like this is the foot and it's my leg. Sometimes with MS you can have a foot drop, all right, and the turf monster can grab your foot. And so an AFO is like a piece of specialized plastic or metal that goes in your shoe, which keeps your foot up. And that way, as you're moving, your foot doesn't flop down. Now, ankle foot orthoses are very lightweight. You can take them on, you can take them off. And they can be very, very valuable for helping you with your walking so that your foot doesn't flop. There's a lot of different things we do for foot drop, and AFO is one of them. They can be very, very valuable. And so I really appreciate people talking about that in the chat. Let's change up the scene a little bit. I'm gonna go back to this. A little bit of fire never hurt nobody. There's 168 of you that have stuck around online. Thank you very, very much. All right, let's take a look at some other questions that we have here. So here's a great question from TVBD. I've read the low white count and low IgG are common in MS. Does this change with Tysabri? So I would say that low white count and low IgG are not common in MS. Oftentimes the problem with MS is the immune system is overly active. Now, TVBD, there are some MS medicines that can drop white count and drop IgG. And the end of the question says, what about Tysabri? Tysabri does not decrease either of these. So we do not see a decreased white count. We do not see a decreased IgG with that. That's awesome. Jane says that she appreciates, I appreciate sharing that with you. River's right here. River, sit. So let's take just a quick hello, howdy, hi, and you guys can see River Bear. Let me get this off the screen to make room for my doggy dog. I don't know how we get that off the screen, but everybody can hopefully see you. Can you say hi to the internet? Mwah. This is my baby girl. Yes, you are. Very sweet. River is 8 years old. She's my puppy, my American Mastiff. She's a work doggy, comes to work with me nearly every day. Does a heck of a job of tooling around the clinic and helping people get through their infusions, helping people get through their appointments. It's really awesome. Sometimes people literally bring her treats when they come to visit, which she loves. And she's a fast friend. She is with me probably more than any other creature on earth, comes to the bathroom with me, comes in the car with me, goes to work with me, sleeps in bed with me. You're a very good baby girl. Can you say hi to the internet? Say hi, everybody. Go ahead and sit down. Good girl. All right, let's get back to doing some questions, guys. I am having a ball on this live stream with you guys. Thank you very, very much. So here's a discussion from Joyce and Jim about depression with MS. So depression is very, very common in the setting of multiple sclerosis. In fact, people impacted by MS are twice as likely to experience clinical depression compared to the general population. Depression is readily treatable. If you are listening to this and you are sad blue and you're experiencing depression, I want you to seek treatment. You don't have to live like that. I have clinical depression. I take I take depression medicines. I see a counselor. I meditate. I exercise, and those things really help me with my depression. And it's my hope that I can help my patients grapple with their depression. Depression is an ugly animal. It colors everything kind of gray, and it can make MS progress faster. You heard me right. Depression can make MS progress faster, and we want to do everything that we can to prevent that from happening. We're talking about MS Water Challenge, and you know what I'm about to do. When I drink, you drink. MS Water Challenge, guys. Let's fire it up. Woo! All right, here's a great question from Claire about where do we think MS research is going. I think that we are headed in some very exciting areas. I think that over the next 10 years, you're gonna see ongoing increased focus on slowing progression of disability and slowing brain volume loss. I think that we're on the cusp of having neuroprotective agents. And we're also on the cusp of having remyelinating agents. And so I think that we're getting smarter and smarter about how we diagnose MS, and we're starting to get smarter and smarter with monitoring MS. And so there's a lot of really exciting things out there. I did a YouTube video a couple weeks back where I shared the 3 things that have me the most excited about MS and with regards to research and treatment. And so the thumbnail is me wearing sort of an orange shawl. If you want to go find that video, you can hear a robust discussion on that topic, absolutely. What else we got going on here? So Love Antha writes, hello, recently diagnosed with MS, or relapsing MS. Let me find the rest of the question. Any recommendation is highly appreciated as you navigate. Well, there's a lot of learning to be done when you're newly diagnosed with MS. And part of the reason that I made this YouTube channel was to help educate, energize, and empower you. I would encourage you to go to the channel and to look at a playlist called Start Here. So I have a playlist called Start Here, and that's where I would start learning. I think that it's very important that you develop a sense of self-advocacy. So if you're experiencing something, I want you to write it down. I want you to bring that to your MS neurologist. We can make MS boring in the modern era. And I oftentimes talk about being 5 for 5 in your fight against MS. And so I have several videos on being 5 for 5. I want you to exercise as part of your lifestyle. I want you to eat smart. We want to up your water game. That's why we do the water challenge here. Supplement your vitamin D. We need to avoid processed foods. We need to make sure that we're not smoking stuff because that can speed up MS. We need to be mindful and spend at least 5 minutes every day being mindful. And I want you on the most effective disease-modifying therapy that you're comfortable taking. These are all things that we can do to up your game and live your very best life despite having MS. It's going to take a year or 2 for you to become comfortable in this condition, but it can be done. And I'm really glad that you're here today. I welcome you to this growing global online community, and thank you very much for that question and for sharing. All right, what else is cooking right now? I am going to jump back to one last video that I've prepared for you. And so, as I shared earlier, I've got a couple of these lined up, and let's watch this together.
At any time illness strikes, most of us, of course, rely on our doctors to help make us better, right? They're there with medication, with treatments, whatever we need to get back to 100%. For treating a chronic illness like multiple sclerosis, some of that treatment will fall on the patient's shoulders. It is what Dr. Boster calls the 5 for 5 in your fight against MS. So here to explain in this sponsored segment, the Boster Center's founder back with us. So good to see you again.
Thanks for having me back. Excited to be here.
And I will tell you, it's kind of hard sometimes to get patients kind of motivated and inspire them to take part in their treatment. But that is what you do, right? You walk side by side, but you need them to take some of that control, right?
It's a partnership, and it definitely is something that we can do together. It's a fool who thinks that you can help someone live their very best life with MS just with a pill.
Yeah.
And so, I want families impacted by MS to be 5 for 5 in their fight.
Okay, what is this then? 5 for 5. It sounds, like an interesting concept. So lay out each step.
Absolutely. So number 1 is to exercise as part of your lifestyle. And I crafted that sentence very carefully. So when you do something as part of your lifestyle, you're not rewarded when you do it, and you're not punished when you don't. So I have a lifestyle of showering in the morning. I don't tweet out, I had a great shower.
Yeah.
And I need people to cultivate a lifestyle where they exercise. And the data is superb that exercising in that fashion slows down the disease process. And so that's number 1.
And sometimes I was just going to say, it's like functional exercise. You don't have to make it like go outside and run 5 miles. Obviously, we know that's not an option.
Absolutely. We need to find something that you don't hate.
Yeah.
Going for a walk, doing a yoga DVD. We want to change it up and keep it exciting and fun.
Yeah.
Really, when you're focusing on exercise for MS, we want to think about flexibility, core strengthening, cardiovascular endurance, and balance.
Okay.
And so, here in Ohio, if you walk during the summer months, you're not going to do that in the winter. And so we have to find ways to do that and keep it fun.
And keep it fun. All right, next up, you're saying obviously eat healthy. And this is something that goes, beyond into your lifestyle as well with exercise, right?
100%. And so it's true that the way that you eat, what you put in your mouth can affect symptoms in multiple sclerosis. And that's a whole giant discussion. The very first thing we start with is upping your water game. So the vast majority of us run around dehydrated. And in the setting of MS, that can have very serious ramifications. Time and time again, when a patient's up their water game, it's remarkable how the bladder's better, the bowel is better. They have less spasticity. They have less fatigue. They think more clearly. It's really fantastic. And so that's where we start. Secondly, and very importantly, we want to up the vitamin D. And so it turns out that low levels of vitamin D drive MS faster. And so you can get vitamin D by going out in the sun or by eating lots of fatty fish. Oftentimes here in Ohio, where we don't have a lot of sun in the winter, we take a pill.
All right, and the next one, it goes kind of hand in hand with you were talking about maybe doing yoga for your exercise. That can be an easy transition into practicing mindfulness.
Absolutely. Now, you and I probably didn't learn about mindfulness in school, and I think they teach that now.
Yeah.
You know, I define it as being in the present moment without prejudice. You're doing something and you're not focused on what may happen tomorrow or what you didn't do yesterday. You're really spending a few minutes a day in that moment. And so there's lots of different ways to do that. Sitting quietly alone and focusing on your breathing, meditating, yoga, going for a walk in the woods, these are all examples of being mindful. And it's my opinion that spending 5 minutes a day being mindful is life-changing.
Oh.
Stress worsens MS, and mindfulness counteracts that.
That's great. And just 5 minutes. I feel like, you know, how attainable is that? Easy.
It's easy to do. You know how I said I have a lifestyle of showering?
Yeah.
When I'm done showering, I sit down in the shower, close my eyes, and I breathe for 5 minutes. It's the best part of my day.
That's all it takes.
Yep.
All right, Dr. Boster, avoid smoking. I mean, this kind of, you know, is without said, but.
No parent tells their kid to smoke up, Johnny.
Yeah.
And yet in the setting of MS, it speeds up the disease almost by 50%.
Wow.
And so not smoking is one of the most impactful things that we can do. Now, it's not just about smoking. Any cardiovascular risk factor can make MS get worse. And so we want not to smoke. We also want to control high blood pressure. We want to control cholesterol. We want to control diabetes. We want to think about the human as a whole. And obviously, not smoking is a key element to living your best life despite having MS.
Now, the other one, and you come in this in a lot of ways too, and that is finding the right treatment. How do you do that with your patients, especially when they feel maybe like one isn't working? It's easy to get discouraged.
That's exactly right. And you know, I like to say, I want you on the most effective disease-modifying drug that you're comfortable taking. And so that doesn't mean it's the most effective drug on the list. It means that's the one that's right for you at that time. And that's really a partnership. That's where you bring your knowledge about your body, and I bring a bunch of books I read, and together we sort it out. And we're constantly evaluating. Why do we get an MRI? Why do we do exams? We're checking to make sure that drug is keeping your disease boring.
And Dr. Boster, one thing that you always come with and you always try to do is just encourage your patients to give them hope. And that probably goes, you know, a long way with these other 5 things into just getting them to the finish line, to getting to them to have a quality of life.
That's exactly right. The goal is to live your very best life despite having MS. And we can do that by being 5 for 5 in our fight.
Okay, so reach out to the Boster Center for MS. It is obviously on the website. You can find all the contact information as well. So Dr. Boster, thank you.
Thank you for having me.
All right, guys. Thank you for letting me share that with you. This is kind of new format, and so I'm really looking forward to trying to see what works and what doesn't. I'm going to be looking at the comments as soon as we wrap up here so I can get feedback from you. A lot of ongoing discussions with Jim Bond, who's really struggling right now. Jim, there's a lot of good advice, and you need to keep fighting. And so I hope that you take to mind what people are saying out there. I think Joyce said it very, very well. There's a lot of help out there if you want to take it. And so I think that we need to continue to fight back. That's what this community is about. And I'm really appreciative of each and every one of you for jumping online today. My name's Aaron Boster, and as always, thank you for learning about MS with me. Until my next live stream, or until my next Monday morning video, or until the next time I see you at the Boster Center for MS, thank you for spending some time on this Saturday with me. And until our next live stream, be safe and take care, everyone. Have a great rest of your weekend.